Here with a quick update on coronavirus. So it's been a while since I did one of these, but I think it's important right now because the country has started to open up and a lot of businesses are opening up and people are getting back to semi-normal life. Yet the coronavirus numbers and unfortunately the deaths are also starting to go up around the country. So there's some confusion about how best we can protect ourselves. And I'm here to tell you today that there are definitely some things that you can do to protect yourself. And I can tell you from my personal experience, back in April, I spent the month doing some work with the coronavirus field hospitals. So I did 12-hour shifts fortunately, I did have the proper PPEs to protect myself. And one of the crucial equipment, as you all know, is a face mask, okay? So if you're actually working with coronavirus patients, or if you're in a household where a family member does have the virus and you know that there's infection there, then it is crucial that you have one of these masks. This is the N95 mask, okay? So the difference between this mask and this is a KN95, which is also something that can be used. And this is your typical medical surgeon's mask that most of us are using. This N95 mask, the material only lets in very, very tiny particles, okay? So this will filter out the virus. And it also, if you're properly fitted, it will fit okay? So now it's a really tight seal, okay? So you have to make sure the seal is tight so that the air is not coming in around the side, okay? You want the air to come in through the filter, okay? So the problem with these masks, besides the fact that it's very hard to get, is that it's kind of difficult to breathe through, okay? So if you are working with known coronavirus patients, or you're going to be in a situation where you're going to have a prolonged contact with someone who has coronavirus, then these masks are crucial, okay? These are lifesavers. You have to use these to protect yourself, and they really work because I can tell you myself, when I was working in the COVID hospital, we had COVID patients all over, and they were only the rooms were just basically curtains, okay? So we're working with coronavirus, it's in the air, and I had to wear these things for 12 hours straight, and that's how our shifts were, and I did not catch coronavirus, okay? So I was tested multiple times after working there, and I was almost certain that I would have antibodies for the coronavirus because of all that exposure I had. But thank God I did not catch coronavirus, and neither did most of the people, as far as I know, that I was working with. In fact, Governor Cuomo said that the data, the governor of New York said that the data indicates, the newest data shows that the frontline workers, the medical workers, if you're looking at the data that came in after these were available, it showed that the frontline workers had actually a lower incidence of testing positive for coronavirus compared to the general public, okay? So frontline medical workers who are working with coronavirus patients all day long had a lower incidence of catching coronavirus than the general public, okay? So that's a very important, and it goes to show that these things work, okay? So now, what do you do if just to protect yourself in normal circumstances. Okay, so these masks, like I said before, they're very uncomfortable because there's no air coming in. There's no air coming in through the sides. The air has to go through the filter, and that's why it helps. It's works the best in protecting you, but it's not really practical to wear these things around town or to go shopping, to go grocery shopping, because you're most likely you're not going to be keeping this on because it's going to be difficult to breathe. So you're going to be doing this, and or one of these things. And so it's not a chin strap. It's not a yarmulke. It's a face mask, and this is where it goes. Okay. So if these things are uncomfortable, and it really doesn't, and the thing is, you don't really need these, okay? If you're just out and about in public, any kind of face covering will work, okay? So these are the most common things you'll see around, okay? So these will cover your face, and what does this do, okay? And you will hear people say now the face mask protects others, okay? If you wear your face mask and other people around you are wearing face masks, even these type of masks are very effective in protecting you and protecting other people. And that is because if you cough or sneeze, it's going to get caught in the mask, and it's not going to projectile, it's not going to aerosolize and project out to infect somebody who is standing next to you, okay? So without the mask, you can, if you cough or sneeze, the viral particles can go 6 feet and maybe even more, okay? So if you're not wearing a mask, you have to stay at least 6 feet away from other people to prevent them from sneezing, or even just talking loudly or singing can send that virus 6 feet and maybe even more, okay? So it's important to wear this. Now, yes, it will protect the other people, but it does have protect you. It will protect you as well, okay? Because this mask will stop droplets from coming, okay? The loud talkers that are kind of spitting when they talk, these will block the little droplets, okay? What it will not stop are aerosolized particles coming in around the sides, okay? And even the KN95 masks, these are very good filters, okay? Almost as good as the N95, but the seal is not as tight as the N95 mask, okay? So if you can't get an N95 mask, a lot of hospital workers are using these, and these are giving great protection too. So what are some other things that we found out? That tells us that these things work, okay? And even these things. So there were 2 hairstylists in Missouri, I believe it was Missouri. There were 2 hairstylists who were not complying with the mandate to close non-essential businesses, and they were seeing clients throughout the closure back in April, May, when everybody was supposed to close. Okay, so they were not behaving because they were not listening, but what they did do was they were wearing masks, okay? They were wearing masks, and all of their clients were wearing masks, okay? So both hairstylists, turns out, were positive for coronavirus. They both tested positive, and they were sick. Well, I don't know if they were sick, but they were certainly infected while they were treating clients throughout the pandemic, throughout the mandatory closure period. But they were wearing masks and all their customers were wearing masks. Okay, so they did the contact tracing and they traced, I think it was like 62 customers that they saw, and none of the customers tested positive. Zero. Okay, zero customers tested positive, even though these two hairstylists were positive for coronavirus. And that can be attributed to the fact that even though they were misbehaving, they weren't completely misbehaving because they were wearing the masks and they were asking their clients to wear masks. So that is actually good news. And we look at, these type of natural experiments. Okay, we're not gonna, it would really not be ethical to ask people, hairstylists, to say, okay, we know you have coronavirus, but let's see if this works. Put the mask on, tell your client that. We wouldn't intentionally do that experiment, but it happened. We have the data now, and that's, we can use that to know that if we wear these, we can protect ourselves. Okay, so it's not hype, it's not theory, it's actual in practice that it works. So now, here's where it's going to get, a little uncomfortable, okay, because this can get kind of political, but I'm not trying to be political. I'm just trying to present the facts to you, okay? When the Black Lives Matter protests started, okay, it's been over a month now, okay, when the protests started, okay, people kind of ignore the stay at home and public gathering mandates against, public gatherings, and people were out in droves protesting. Okay, so our big concern was all these people are out there protesting, and we're talking about tens of thousands of people gathering and together, not social distancing, and we were very concerned that this was going to be what we call one of those super spreader events, and it was happening all over the country, and even in New York City, where at the time we had the highest number of coronavirus cases, okay, and people were out there protesting by the thousands, and we were bracing for the huge number of people that were going to become positive and spread the virus, and the numbers that had been coming down, our concern was the numbers were just going to go right back up because of the people gathering for the protest. Now, it's been a month since it started, okay, and so far, we have not seen the numbers go up in New York City. In fact, the numbers are continuing to go down. And this past weekend, we had 0 deaths in New York over a 24-hour period. And that's huge, because people were dying by the thousands, and the numbers are coming down. So what does that tell us? Why didn't all these people out there protesting catch coronavirus? Okay, I have there's some theories about that, and they're pretty solid. Okay, so remember, these masks do help. Okay, not everybody was wearing masks. Okay, but a lot of the people in New York were wearing masks while protesting. So even though they were not social distancing, they were wearing masks, okay? So even though not everybody was wearing masks, enough people were wearing it that the people who were infected weren't spreading it, and the people who were not infected were getting some protection from these masks, okay? The other reason why I think that people did not catch the virus in the numbers, and I'm sure some people did, but not in the numbers that we were afraid of, is that it is outdoors. Okay, so outdoors, there's a lot of ventilation. These aerosolized droplets are going to get blown away by the breeze, and they're not going to linger in the air. Okay, and the other thing is that people were moving around. They weren't standing still. They were moving around. So in order to catch coronavirus, you need to have contact. Okay, you need the exposure, but you also need prolonged exposure. 1 or 2 viral particles going in that you breathe in is very unlikely to infect you. Okay, but thousands of particles getting breathed in or going into your mouth is going to infect you. Okay, so the fact that these people were moving around probably prevented them from being exposed to the virus enough to get infected. Okay, so those were 3 things: the mask, being outdoors, and also moving around. How does that compare to a rally, a political rally in an indoor environment? Okay, how is that different? Okay, when you're indoors, okay, whether it's a rally or a sporting event, if you're indoors, you're going to be in close contact with other people, and you're probably not moving around. You're probably staying at your seats. And if the person next to you is infected or the person behind you is infected, they're spewing viral particles around them, okay? And the viral particles are lingering in the air. And if you're next to them and you're not wearing a mask and they're not wearing a mask, those viral particles are just going to kind of linger around, and eventually you're going to breathe in enough viral particles to get infected. And that is why, unfortunately, a lot of people, it looks like, and it's still in the early phases, but Tulsa, Oklahoma is their coronavirus positive tests are starting to really go up, and most experts are attributing it to the rally. Okay, you can't really prove it, but Tulsa, Oklahoma is not an area like New York City where the virus would naturally spread that fast. So they are kind of attributing it to people not wearing masks, people being indoors, and people shouting and being in close proximity. Okay, so these are natural experiments that we would not tell people, take a group of people, you know, put them in an enclosed space and see if they get infected. That would be unethical, but it happened. So what we can do now is look at the data that comes out of this. So what does that mean for us? Okay. What it means is that we can reopen the country, we can restart our businesses if we know how to protect ourselves and protect each other. And that is why it is so frustrating when people refuse to wear the masks. Now, some people have health conditions that that they say that prevent them from wearing a mask. Now, if you do have a health condition, if you have asthma, if you have COPD, if you have a lung condition that makes you more vulnerable to not getting enough oxygen when you wear a mask, imagine what will happen if you do catch coronavirus, if you do catch COVID-19 and you get sick, okay? You're gonna die. I mean, that's what will happen if you get sick. So why would you go out in public where you don't know who has coronavirus? Because there's a lot of asymptomatic people out there, okay? The people who are out there who, you know, it wouldn't affect their health to wear a mask. It's not going to compromise anything. And yet they're not wearing a mask. They're spewing virus into the environment. And you want to go into a store with no mask on and you have a health condition, that's suicide. Okay? So if you have a health condition and it's not, and if you feel it's not safe for you to wear a mask, then please don't go into a store or an enclosed space with no mask on. Stay outside or even stay home. Ask somebody to get what you need for you. Or most of these businesses have curbside service. So you can ask one of their employees to get the things that you need and you stay outside. You don't have to put the mask on. Just stay outside and do yourself a favor and, you know, be respectful for the other people that are inside wearing masks, okay? Because this is how we're going to reopen the country. This is how we're going to keep our businesses going. Okay, it's a small price to pay. It's a small price to pay to cover your face if you're going to be indoors, okay? It's not too much to ask for, folks, and it's really is for all of our own goods. If we do, now we know what we can do to prevent the spread of this terrible disease, and what we can't do is just turn on each other and fight about these masks, okay? Because they work. They work, and the evidence is overwhelming around the world, in this country, and I can tell you from personal experience that these masks work. This mask saved my life working with coronavirus patients. Okay, so you're more likely to catch coronavirus if you're out in public and you're not wearing anything to protect yourself. You don't know who is sick around you. So please be responsible. And I hope this is helpful. And God bless you. Stay safe. We'll see you soon.